And a reminder, that was not for the gold medal. They beat Finland for the gold medal back in the '80 Winter Olympics. Welcome back to Western New York Living. Do you sometimes experience ringing, buzzing, or maybe chirping in your ears? If this problem is familiar to you, you may be suffering from a hearing disorder called tinnitus. My first guest this morning is here to join to talk about hearing issue of tinnitus and what can be done to alleviate this problem. And it's a pleasure to have Dr. Jill Bernstein from Hearing Evaluation Service of Buffalo back with us. Good to see you again.
Thanks very much.
Well, why don't you, the ringing is tinnitus, but why don't you explain exactly what tinnitus is and what leads up to it for people?
Yeah, so about 60% of the time tinnitus is related to hearing loss, actually, and it's just kind of a deprivation of sound that the brain isn't used to hearing the way that it used to anymore, so it creates that phantom sound that can sound like a lot of different things depending on the person. It could be a whooshing, a ringing, a chirping, and even some people it's music. Right. I mean,
everybody's been to a concert at some point and they hear the ringing in their ears afterwards. Is that part of it? It's not permanent, but that's part of it?
It is. It's temporary, but the more dangerous exposures you have, the less recovery you get. So when you leave a concert, if your hearing is diminished and you hear that high-pitched tone, usually the next day it's better, but the more frequently you encounter that kind of loud noise, the less recovery you'll get down the line. So it's important to protect your hearing.
See Bradley Cooper's character in A Star Is Born.
That's right.
Tinnitus. One of the misconceptions is people, well, you just have to live with it, but that's not the case, right?
No, we actually have some really successful management techniques now. It's not something that we cure, but it's something that we manage. Using a lot of different techniques. We have a four-pronged approach. We have some specialists who are focused specifically on helping people with bothersome tinnitus, and it involves relaxation strategies, a lot of counseling and education, acoustic therapy, and when needed, if there's also underlying hearing loss, we'll use amplification.
And what's the success rate that you've had with these programs?
It's a great question. So nationally, the success rate for managing tinnitus is about 60%. And that's what our program is. In as little as 6 weeks, people report at least a 60% reduction in their tinnitus.
Now, there are support groups for this, correct? Explain what happens in a support group and what people can learn when they attend it.
Yeah, so support groups can be helpful for lots of different kinds of problems, but it helps people feel less alone with what's happening, learn what strategies might work for other people, because there's sort of one perception of the sound in your ears, but there's lots of different causes and lots of different ways that people might get relief. So it's good to get exposure to that and get support from other people.
I guess the message is this is something that someone says, I'm used to it. You don't have to be used to it. This can be improved.
Yeah.
You guys can make it better.
Yeah, about 30 million people actually have it. But only about 3.5 million report it's so severe that it actually disables them in their life. And those are the people that it's really important that come in for help.
And people who come in, you guys also do, it's hearing evaluation services, hearing tests, something that people, adults, probably don't get often enough, do they?
Right. Baseline at 50, even if you don't have a problem, but especially if you have any kind of noises in the ears, it's worth getting it checked out. It's not always related to hearing, but if that's the cause, it's the most easily addressed.
How can people, what can people do to avoid tinnitus? What can they do to protect themselves?
So as much as possible, you want to minimize your exposure to noise. If you're around loud noise, snow blowers, lawn mowers, concerts, use hearing protection when possible. And sometimes it's just unavoidable. It can be genetics, it can be medication, it can be diet. And in those circumstances, the best thing to do is just address it as it happens.
Yeah, low level in the earbuds too, right? Which we're all wear earbuds all the time. These folks can help. Hearing Evaluation Service of Buffalo. They have offices in Amherst, Williamsville, Orchard Park, and Tonawanda. To find out more about all of the hearing services they provide, head over to their website at hesofbuffalo.org. You can also give them a call, 833-4488. If you believe you suffer from tinnitus or any other hearing-related issue, make sure you contact Hearing Evaluation Services of Buffalo. Remember, everyone's encouraged to join their tinnitus support group held on select Wednesdays. Now, coming up next, it's time to batten down the hatches because we're going to have a preview of the upcoming Western New York Boat Show. It opens this coming Wednesday, and we'll tell you about all the great vendors that are involved when we return.
This segment of Western New York Living was sponsored by the following: